Dr. Lyons, one of the most popular procedures we do here at the center are the facial fillers, the Hyaluronics, the Juvederm, the Radius, the Restylane, and I'd like you to get into how those differ or add to a facelift, and in general, the difference between the two.
Okay, that's a great question, and I enjoy answering it because a lot of the misconception is that they're lateral, is that they do the same thing. So some patients I'll see say, you know what, I would have a facelift, but I can't afford that, so I'll have some fillers. Well, you know, they don't interchange with each other. One thing does one thing, and one thing does another thing. So when I think about fillers, we focus on details. So I want you to think about a painting. So if you look at a painting and there's details of this face which make you feel that it looks tired, and you could change some of the details, one detail at a time, that's what fillers do. So for instance, if someone has deep nasolabial folds, we use a filler such as a hyaluronic acid, Juvederm, or Restylane. If someone has a weak cheek, we can build up their cheekbones, make them look more rejuvenated, more youthful, with another filler called Radius or Sculptra, or even fat transfer. If someone has a marionette line or a jowl, you could fill that area in, or the obvious, most important, not filler, but treatment for wrinkles of the forehead, which is Botox or another neurotoxin. But what that does is freshen things up, it airbrushes things. It doesn't really change the painting, it just airbrushes things to make things look a lot better. So at one end of the spectrum, if you have somebody who's younger, either chronologically or younger visually, that is, they may be older, chronologically where their face looks younger, has less issues, the fillers and the Botox work to achieve a result. But a lot of my patients, even with the detail change, still look tired. And that's because the overall picture needs to be changed, needs to be framed. And that's when you move into the category of a facelift. And they're not interchangeable. Point well made by the fact that a lot of times after I reframe the face with a facelift, I still want to do some fillers in the central facial zone to sort of match the framing that I did. But also what fillers do is change things three-dimensionally with little two-dimensional change, whereas a facelift really redefines the two-dimension, some three-dimension. So as an artist working on faces, the opportunity to work both three-dimensionally, two-dimensionally affords the best and most natural results. So younger patients could achieve great results with fillers. As you get older and more tissue issues happen, that is excess muscle, muscle bands, repositioning of fat, too much excess skin, you really want to reframe the face with the facelift. So they have a different looking result, different indications, and they're not interchangeable, both very effective in the right patient.